I get called a birth bestie. I'm an auntie to a lot of babies. And, you know, it's a part of aspect that people will always say, you will always be part of their journey. They'll always know. It's different to an obstetrician and a midwife because I see they're already what it's like at home as well.
Hi, Ness, how are you?
People always ask me, why didn't I choose to become a midwife versus a doula? I wanted to be, you know, not behind the system. I wanted to be with them in their raw component when it came to birth. And yes, a midwife is, and I work with beautiful midwives, but I wanted to be in a different type of role. You know, being on their journey, being that call of contact at any point is, you know, something that I cherish and I like to do. So how are you feeling?
Yeah, I'm feeling really good. Just a bit sore.
I remember I spoke to my mother when I was starting my training and I explained what a role of a doula was, because obviously people don't understand what a doula is most of the time. And my mum went home and she said to me, oh, my grandmother in the southern Italy. I remember as a child she would get up in the middle of the night and assist a midwife. She was there to keep them calm and help the midwife deliver the baby. And so I did research and found out that my great-grandmother in south of Italy was a doula. So it's in me, through my blood. How are you feeling about birth?
I'm terrified, but I know that I have a good team up my sleeve.
Yeah.
I believe that having a doula is that extra layer of reassurance. So you have the doctor, which is great, but then you have the doula that you can call 24/7, 7 days a week, and I can be like, hi, can I eat the chicken that's a day old? And she'll be like, yes or no. And there's that reassurance then rather than me bothering a doctor.
I think there is lots of birth trauma, and birth satisfaction is the most important thing that women are looking for. And to be able to have that element of emotional support and education is probably the biggest reason why people are on to look at changing their birth. And that's an aspect of why people are looking for doulas. If depending on what labour looks like, remember it's not like the movies that your waters break and you're at Coles and then all of a sudden it hits the floor. Doesn't work like
just to pick up a phone and have someone that is not your mum, not your sister, not your friend who's judgmental, or they see it one way and not your way. And she's gone through pregnancy herself also, and she's birthed I think over 70 babies. So I know that I'm talking to the right person, and she just calms my nerves.
Really, people are wanting to be able to feel supported emotionally. I think mental health in the birthing and fourth trimester, because we always forget about the fourth trimester, is to be able to have that village. And we did have those village back in the time, but now it's creating that, and how we do that, and that's through a doula.
Things were a lot different many, many years ago. As a woman going through birth, you would have seen hundreds of births beforehand. Women's in the village, your mother, your sister, your auntie, all these people will have actually had babies around you. So it was not something that was foreign to you when you actually gave birth. So nowadays, the only real exposure we get to birth prior to our own is really only through social media and also through the television, which of course is not a true representation of what birth is actually like.
I'm having trouble breathing at the moment.
Yeah. So I think as an obstetrician, I can certainly provide really good medical care for my patients. But, you know, we all need to know our limitations. And as an obstetrician, I'm not in tune with all the mental and anxieties that are around, pregnancy and birth.
I think the reason he chose to have a doula within his practice, he does talk about it very often, that there's an element that he understood that he couldn't bring. Obviously he's medical, and the emotional and physical support in a different aspect, because obviously doctor and midwives go in that mode when things happen, but he understands, and he would obviously love to, and he does, being able to give that to his patients. But in the time that he's medical, he knows that part of his team is giving their support.
All right, so the most sensitive measure of the baby's health and well-being is their belly size.
Vanessa is exclusive to my obstetrician, so they work as a birth team, and that is why I chose my obstetrician, because I found Vanessa online and then found out that she works exclusive with Joe Scroy.
Kidneys again.
She's basically like a baby therapist for pregnant women.
Magnificent, happy baby.
Having someone where we both know each other's roles really well, it's a bit like having a co-pilot and a pilot on a plane. It means that we're understanding what our position and station is in terms of the whole birthing process, but more importantly, we're able to leverage off that common knowledge to support the woman during her pregnancy, birth, and obviously in the postpartum period.
The nappies are in here.
Okay.
Any problem, any pain, any question that I have. I had some bleeding early on in the pregnancy and she troubleshooted with me through that. And then, the end result was me going in to get checked. But if I didn't have Vanessa, I would have never have known what to do in that moment.
I think doulas provide that ongoing reassurance. There is a path that moves through pregnancy and there's a path that's going to happen through the process of birth and certainly in the postpartum period. And sometimes we just need a reassurance that that path that we're navigating is absolutely normal.
It's just having that reassurance constantly through this whole process. And she's got me to 35 weeks, so that's the biggest challenge. And then we've just got to get to the end.
As I help women create their village, I have a village at home that allows me to be able to be on call, and my children love and get a buzz when the doula bag comes out, that they know that there's a baby coming, and so they're very much part of the journey. But when I am at home, and clients know I'm a mother and they know that I have children at home, so they're also very cautious that I'm filling up my cup and spending family time. So it's a juggle, but I couldn't think of anything else to be doing. It's something that I absolutely love.